Στο πλαίσιο του εορτασμού της Παγκόσμιας Ημέρας έχουμε λάβει κάποια μηνύματα ακόμα από ευρωπαϊκές οργανώσεις που ασχολούνται με την καταπολέμηση του καρκίνου και παρακαλώ πολύ να περάσουμε στο πρώτο μήνυμα.
Hello, I'm Lorna Warwick, CEO of Lymphoma Coalition, and I wanted to start by congratulating the Hellenic Cancer Federation on their 8th annual Congress. That is quite the milestone. The conference theme of patient-centered care, co-creating the framework, is inspiring and very important. Lymphoma Coalition is incredibly grateful for all the amazing work our member organizations are doing to improve the lives of those living with lymphoma. I was encouraged to learn about the Union for International Cancer Control's objective behind World Cancer Day 2024. The way they have invited everyone globally to engage government leaders in their countries, asking to improve health equity, accessibility of cancer services, reduce disparities in cancer incidence and mortality, closing the care gap is so important. Lymphoma Coalition supports this wholeheartedly, as we also believe that by working together, a better future for everyone affected by lymphoma is possible. Lymphoma Coalition works towards this vision of a better future for those impacted by lymphoma by generating and providing trusted information, knowledge, and best practices to influence and improve care. It is vital we all continue to advocate and raise awareness for those living with lymphoma. We must demand change on a local level, a key objective behind World Cancer Day 2024. We believe when patients and their loved ones share their experiences, the amplification of all those voices can lead to improved outcomes and ensure care is patient-centered. One of the ways we do this is through our global patient survey on lymphomas and CLL, which we just launched on February 2nd. It will remain open for about 2 months to allow us time to gather many inputs and perspectives. We have been doing these kinds of surveys since 2008. And we know from experience this work provides a solid understanding of current patient and caregiver experiences and areas for improvement, as well as uncovering trends and themes across the globe. We leverage the data from the survey and translate it into tangible results that have a meaningful impact across the healthcare spectrum, such as educating healthcare professionals about patient experience, which can lead to improved care at the bedside, while also providing evidence for decision makers to accelerate decisions that improve health policy. This data is used at a local level by patient organizations in their countries, as well as regionally and globally. So please consider joining the effort and taking the survey today. By collaborating with amazing patient organizations, together we can strengthen the impact of our work, not only today for World Cancer Day, but going beyond and championing each other's work year-round. In doing this, we can become one step closer to achieving our ultimate goal, improving the lives of those impacted by lymphoma. Please join me in sharing UICC's call to action and do your part to close the care gap this World Cancer Day. Thank you.
Χαιρόμαστε ιδιαίτερα που ακούμε και από αυτό το μήνυμα την αναγκαιότητα της ενότητας και της συνεργασίας. Να αναφέρουμε ότι η Ελληνική Ομοσπονδία Καρκίνου αποτελεί μέλος της Lymphoma Coalition και είμαστε πολύ χαρούμενοι για αυτό, γιατί με αυτόν τον τρόπο, μέσα από έναν ανοιχτό διάβλο επικοινωνίας, μπορούμε να συμβάλλουμε σε έναν κοινό σκοπό και στόχο. Παρακαλώ πολύ να ακούσουμε και το επόμενο μήνυμα από την ΕuropaUomo, μια άλλη διεθνή οργάνωση.
Ladies and gentlemen, thank you very much for the invitation to express some words here, especially targeting to the World Cancer Day. And as you know me, I'm the active chairman of EuropaUomo, the European Prostate Cancer Coalition. So, of course, we are talking about this cancer, which by incidence at the moment is the most happening cancer for men in Europe. And regarding mortality, is already number 2. We have bypassed colon and we are behind the lung cancer. What we are on it, we want to see to it that with the backup of the European Association of Urology and the European Commissioner to have pilots through Europe to make sure that our idea of a structured PSA screening and prostate cancer screening means early detection makes sense. In clear terms, we want to see to it that people are invited in countries for pilots, and that is in Spain, in Galicia, and Barcelona, in the Republic of Ireland, in Poland and Lithuania, to make sure that we get results with a structured setup, meaning starts with the PSA, with ranges up to 1, up to 3, and above 3. It will have above 3 an MRI, which is necessary to have it visual imaging, comes to finally a risk calculator. If there's still suspicion, it goes to a fusion-guided biopsy. Seeing the first figures of a huge cohort in Germany, we can say that about 90% will have a PSA below 1, come back in 5 years. Another 8.5% will have a PSA up to 3, coming back in 2 years. And only 1.5 to maximum 2% are eligible for an MRI. And in most cases there, we have a clinical significant prostate cancer, meaning in clear terms anything between active surveillance and progress is there, and we have to see to it that we have countermeasures there.
Ευχαριστούμε πολύ και την ΕuropaUomo, μια οργάνωση με σημαντική δράση για την αντιμετώπιση του καρκίνου του προστάτη. Και περνάμε αμέσως στη διαδικτυακή σύνδεση. Έχουμε τη χαρά να έχουμε κοντά μας τον Υπουργό Υγείας, κύριο Άδωνη Γεωργιάδη. Θα μας μιλήσει για την εφαρμογή της Εθνικής Στρατηγικής για τον Καρκίνο.